What if I told you that the one habit you repeat every single week because you are trying to be responsible, trying to stretch your groceries, trying to eat well on a budget, is quietly putting your heart and your body at serious risk? Not from eating the wrong food, from reheating the right food the wrong way. And for people over 60, the consequences are not just uncomfortable, they can be life-changing. I am Dr. Thomas Reeves, a cardiologist with over 10 years of experience helping patients like you take control of their blood pressure, protect their heart, and improve their overall health. If you are new here, welcome to the channel. Before we go any further, if you are serious about maintaining healthy blood pressure, strengthening your heart, and living with confidence, hit that subscribe button and turn on notifications. I share real information backed by real science for people just like you. And if this topic matters to you, type 1 in the comments and tell me where in the world you are watching from. If not, type 0 so I know how to help you better next time. Now let us get into it. Here is something most people have never been told, and I want you to sit with this for a moment. Your kitchen is not neutral territory. Every time heat meets certain foods for the second time, a chemical transformation begins. And while a healthy 30-year-old body may handle that transformation with relatively little consequence, a body over 60 is a different story entirely. Here is why. As we age, the systems responsible for neutralizing harmful compounds in our food become significantly less efficient. The liver works more slowly. The gastrointestinal lining becomes thinner and more reactive. Circulation, which you already know is a priority if you are watching this channel, becomes more vulnerable to inflammatory triggers. And blood pressure, already a challenge for millions of seniors, can be pushed in the wrong direction by compounds that form in reheated food that most of us never even knew existed. I want to be precise here. This is not about fear. This is about biochemistry. And once you understand what is actually happening inside these 3 specific foods, the moment heat touches them a second time, you will make different decisions at the stove. Decisions that could protect your heart for years to come. Now, before I name the 3 foods, I need to give you the chemical foundation that makes all of this make sense. Because without it, this will sound like a food myth rather than the documented science it actually is. When food is cooked for the first time, natural chemical reactions occur between proteins, sugars, fats, and heat. In many cases, the compounds produced are present in small enough amounts that the body handles them without difficulty. But reheating changes that equation in 3 critical ways. First, whatever protective antioxidant compounds were present in the original food are further broken down or destroyed entirely. For seniors, this matters more than for younger people because your body is already producing fewer of its own antioxidants with each passing decade. Second, the chemical reactions that produced small amounts of harmful compounds during first cooking begin again, but without the protective buffers that were there the first time around. Third, in many foods, bacterial and enzymatic activity during cooling and storage has already begun converting certain compounds into more reactive intermediate forms. When you apply heat again, those intermediates are driven forward into compounds that research has directly linked to cancer development, cardiovascular damage, and chronic inflammation. The 3 classes of compounds we are most concerned about are N-nitroso compounds, also known as nitrosamines, lipid oxidation byproducts, specifically aldehydes, and heat-stable bacterial toxins that survive reheating completely intact. Each of those 3 classes connects to a different food, and each has a direct line to the cardiovascular system and the cancer risks that affect seniors at higher rates than any other age group. Let us begin. Food 1, processed and cured meats. I know what some of you are thinking. Bacon, sausage, ham, the foods that have already been discussed in health circles for years. But here is what most of those conversations miss entirely, and this is the part that most patients I see have never heard before. The danger is not just in eating processed meat. The danger multiplies dramatically the second heat touches it again. Here is the chemistry. Processed and cured meats, your deli slices, your breakfast sausage links, your canned ham, your smoked cuts, are manufactured using nitrites and nitrates as preservatives. Those preservatives react with the amines naturally present in meat protein during the curing process. The result is a class of compounds called nitrosamines, which have been classified by the International Agency for Research on Cancer as probable human carcinogens. Now, here is the critical point. Those nitrosamines are already present in the meat before you ever bring it home. When you reheat it, particularly at high temperatures in a microwave or in a pan, you are applying heat to a food that already contains documented carcinogenic compounds, and heat accelerates nitrosamine formation. The hotter the temperature, the longer the exposure, the more the reaction compounds. Research published in peer-reviewed journals examining dietary N-nitroso compounds and cancer risk has identified high intake of these compounds as one of the most consistent dietary pathways to pancreatic cancer. And for seniors specifically, the combination of increased nitrosamine exposure from reheated processed meats alongside already compromised vascular health creates a double burden. Your blood vessels are already working harder. Adding inflammatory carcinogenic compounds to that load is the equivalent of adding weight to a bridge that is already at capacity. What should you do instead? If you are going to eat processed meats, eat them once, prepared fresh, and do not return them to the microwave. Cold the next day in a sandwich is a far safer option than hot for breakfast again. That is food one. And already, I suspect some of you are rethinking this morning's breakfast plans. Good. That is exactly the point. But food two is the one that tends to genuinely surprise people, because it is something that seniors are specifically told to eat more of, and for good reason, until the reheating begins. Just to stay with me for a moment. We have established that processed meats already contain nitrosamines before reheating even begins, and that heat drives that formation further. That is the compound, that is the pathway, and that is why once is already a chemical event, but twice is a risk you do not need to take. Now let us talk about a food that seems like the opposite of dangerous. Food 2, spinach and high nitrate leafy greens. Spinach is one of the most consistently recommended foods for cardiovascular health, and that recommendation is not wrong. Spinach is genuinely rich in potassium, magnesium, and dietary nitrates that support healthy blood pressure by promoting nitric oxide production in the blood vessels. Nitric oxide relaxes and widens blood vessel walls, improving circulation and reducing the pressure your heart has to work against. For anyone managing high blood pressure, spinach is genuinely a friend until you reheat it. Here's what happens. Fresh spinach contains naturally occurring nitrates, and those nitrates are entirely benign in the raw or freshly cooked vegetable. They are, in fact, part of why spinach is so good for your heart. But when spinach is cooked and then allowed to cool, something shifts. Bacterial activity and enzymatic reactions within the cooked vegetable begin converting those beneficial nitrates into nitrites. This conversion happens continuously during storage, even in the refrigerator. The longer the cooked spinach sits, the higher the nitrite concentration becomes. When you reheat it, two things happen simultaneously. The heat drives further nitrite formation, and the heat also drives a reaction between those nitrites and the amino acids present in the spinach itself, producing nitrosamines, the same class of carcinogenic compound we discussed with processed meat. A study published in the journal Foods specifically cautioned against storing boiled spinach for more than 12 hours at room temperature precisely because of this direct conversion pathway. The same applies to other high nitrate vegetables: celery, beetroot, kale, and carrots. Celery in particular contains extremely high concentrations of nitrates. When celery is cooked into soups and stews and then reheated repeatedly, as happens regularly in home cooking, each reheating cycle drives the nitrate to nitrite to nitrosamine conversion further along. The World Health Organization has confirmed that nitrosamines formed in food are established carcinogens linked to gastrointestinal and pancreatic cancers. And for seniors whose gastrointestinal lining is already more sensitive and whose circulation is already under additional pressure from aging, repeated low-level exposure to these compounds through reheated leafy greens is a risk that is completely unnecessary when the solution is so straightforward. Cook spinach and leafy greens fresh, in the quantity you will eat immediately. If you have leftover cooked spinach, eat it cold the next day in a salad or toss it into a cold dish. Cold does not drive the nitrosamine forming reaction. Heat does. That distinction is the entire point. Now, before we get to food 3, which I want you to pay close attention to because it connects directly to one of the most common cooking habits among seniors, I want to take a moment. If you are finding this information genuinely useful, if this is changing how you think about your kitchen and your cardiovascular health, please subscribe to this channel right now. I release new videos regularly covering the science behind blood pressure, heart health, and longevity for people over 60. The kind of information your doctor wishes they had time to explain in a 15-minute appointment. Subscribe and make sure you never miss it. Now, food 3. And this one surprises people for an entirely different reason, because the risk here is not the same chemical pathway as the first two. It is something else entirely, and it connects to a habit that is almost universal. Food 3, rice. Cooked rice, stored in the refrigerator, reheated for tomorrow's lunch or dinner. This is one of the most common cooking habits in the world, and particularly common in households where batch cooking is a way of life. And here is what most people never learn. The danger from reheated rice is not primarily carcinogenic in the direct chemical sense of the previous two foods. The danger is biological, and it is heat resistant, which means your microwave cannot fix it. This is how it works. When rice is cooked and then left to cool, a bacterium called Bacillus cereus becomes the problem. The spores of this bacterium survive the original boiling process and remain dormant in the cooked grain. As the rice cools, those spores germinate. The bacteria multiply, and as they multiply, they produce toxins, two specific types. One causes vomiting within hours of consumption. The second causes diarrhea and is produced specifically during the storage phase, not after reheating. Here is the part that changes everything. When you reheat the rice, you kill the bacteria. But the toxins they have already produced are heat stable. They survive full microwave reheating. They survive stovetop reheating. The bacteria are gone. The toxins remain in the food. And for a senior whose digestive system is already more sensitive, whose gut lining is already less resilient, and whose immune response is already slower, those toxins are a more serious problem than they would be for someone younger. In the short term, rice reheating toxins cause nausea, vomiting, abdominal cramping, and diarrhea. Unpleasant for anyone, but genuinely dangerous for seniors who are more vulnerable to dehydration and electrolyte imbalance, both of which place direct strain on the cardiovascular system. A serious bout of dehydration can raise blood pressure sharply, reduce blood volume, and trigger dangerous fluctuations in heart rhythm. In the longer term, and this is the connection that most people never hear about, repeated low-level exposure to bacterial toxins from improperly stored and reheated rice contributes to chronic intestinal inflammation. And chronic inflammation of the gastrointestinal tract is one of the most extensively documented pathways to gastrointestinal cancers. Every time the intestinal lining is irritated by heat-resistant bacterial toxins, the inflammatory response leaves microscopic damage. Over years and decades of weekly exposure, that accumulated damage creates the cellular environment in which cancer can develop. The good news is that the protocol for safer rice handling is specific and simple. After cooking, cool rice quickly within 1 hour and refrigerate it immediately. The rapid cooling prevents the temperature from staying in the bacterial growth range long enough for significant toxin production. Store refrigerated for no more than 24 hours. When reheating, reheat once only and ensure the rice reaches steaming hot temperature throughout, not just warm in the center. And never reheat rice a second time. If there is rice left after reheating once, discard it. Better still, cook rice in smaller quantities so there is less left over. If you routinely cook large batches to save time, consider changing that habit. The convenience is not worth the cumulative risk of repeated toxin exposure across years and decades of weekly meals. Let me bring this all together, because I want you leaving this video with a clear and actionable picture. Not anxiety, but information. And 4 specific habit changes that will reduce your risk meaningfully. 3 foods, 3 distinct mechanisms. 1 unifying principle. Reheating triggers chemical and biological changes that the body, particularly the body over 60, is less equipped to handle than it once was. Reheated processed meats produce nitrosamines and nitroso compounds that research has specifically linked to pancreatic cancer development, and that the International Agency for Research on Cancer classifies as probable human carcinogens. The practical change: eat processed meats once, prepared fresh, and never return them to the microwave on high heat. Reheated spinach and high-nitrate leafy greens convert their naturally occurring and genuinely beneficial nitrates into nitrites and then into nitrosamines through a heat-driven reaction that is completely preventable. The practical change: cook leafy greens fresh in the quantity you will eat immediately. Eat leftovers cold the next day. Improperly stored and reheated, rice delivers heat-stable bacterial toxins that survive the microwave and accumulate as chronic intestinal inflammation over years of repeated exposure. The practical change: cool cooked rice quickly. Refrigerate within 1 hour, store for no more than 24 hours, reheat once only to steaming temperature throughout, and cook smaller quantities. Those 3 changes, applied consistently to your weekly kitchen routine, meaningfully reduce your exposure to the specific compounds that researchers and cardiologists connect to the cancers and cardiovascular complications that affect seniors at the highest rates. Now, I want to hear from you in the comments. Which of these 3 foods surprised you the most? Because in my experience, the answer to that question tells me exactly where the gap in public health education is widest, and your comment genuinely shapes the videos I make for you next. If this video gave you something that will change how you cook this week, please share it with someone who needs to hear it. The person in your family who reheats their leftover sausage every morning. The friend who makes a big pot of rice on Sunday and eats it all week. That share may be the most useful thing you do for their health today. Subscribe for more honest conversations about what science actually says about the food and lifestyle choices that matter most for people over 60. One important note before you go: everything I have shared today is based on published biochemistry, food science research, and the documented work of international cancer research organizations. This is educational information, not personal medical advice for your individual situation. The connection between dietary carcinogens and cancer risk is well established in the research literature, but cancer and cardiovascular disease are complex conditions, and individual risk depends on many factors that I do not know about you personally. If you have concerns about your diet, your blood pressure, or your cancer risk, please have that conversation with your own physician who knows your history and your health. I am Dr. Thomas Reeves. Protect your heart with the information your kitchen never came with. I will see you in the next one.